So I'm going to just turn the page and talk about some different types of things. And so, next slide, please. So one of my colleagues, Dr. Kiami Mahania, and I'm sorry if I messed up your name, but he reminded me that sometimes it takes a drama to see something that was just right in our faces. I mean, COVID has been just terrible. It has wreaked havoc on our communities. Yet we're realizing that there has never been so much attention for racial and ethnic and all kinds of inequities. But then we question, why did COVID-19 affect the Black and Brown community so much? Why was it so devastating? Well, next slide. The answer lies in that your health can be affected by where you live. Our country has had hundreds of years of legal segregation since the start of slavery, but then followed by decades of racist housing policies like redlining. And this is the redlining map for the Boston area that pretty much denied any services and goods to certain areas, to um, individuals or companies, just because they were located in certain areas that were deemed to have a poor financial profit, which unfortunately those areas were where brown and Black people lived. And so, as I walk you through the animations of this slide, I just want you to think about how all this could increase your risk for getting the COVID virus, but then also how it can increase your risk of having a more severe illness, or COVID-19 illness. I just picked that up from Dr. Faust as far as just not, anyways, let me keep going. So these economically depressed areas, they tended to have under-resourced schools that affected your child not being able to go to college or get a better paying job. And guess what? Well, your child couldn't move out, so I had to live with you. Again, talking about that social distancing thing. And then with the next animation, you have these houses that are closer together and again, multi-generational. And again, not too great for social distancing. Then your neighborhood has increased exposure to environmental pollutants, maybe from factories that were nearby because they were undesired neighborhoods to live in, but then also maybe tobacco smoke because these areas tended to have chronic stress and lots of people were smoking due to that. And just think about how all of that, the air pollution, can be bad for someone who has asthma or chronic lung problems, of which COVID-19, if you had that, you were at increased risk for having a higher severity of illness. And I didn't even talk about increased risk of cancer due to air and water pollutants as well. But then also, these neighborhoods usually were food deserts. They had food deserts where you had a paucity of healthy food choices. So if you have diabetes, you're at increased risk of increasing the complications of diabetes, like kidney disease, heart disease, vision or eye problems. And unfortunately, that with COVID, you have diabetes, that increases your risk of more severe illnesses. And also, if you don't have healthy food choices, you increase your risk for obesity. And unfortunately, COVID was very fond of people who are more obese. Next slide, please. And also, I forgot the transportation, but with transportation, you had decreased access to be able to travel to better healthcare systems, but then also to get that better paying job. And so that affected your health as well. Only 20% of Black Americans were able to work from home during this pandemic, and they had a larger share of frontline worker jobs, increasing their risk for exposure to the virus. I gave huge thank yous to all of our environmental workers who carefully cleaned up those COVID positive rooms. And I'm not saying at which institutions that I heard of janitors dying, but yeah, you heard about janitors actually dying. But then I also gave huge thank yous to all those folks who worked at grocery stores, who worked at CVS, and think about those Amazon delivery folks. Give them huge thank yous for putting their lives on the front line. It was the exposure and having the underlying, sometimes uncontrolled medical conditions like obesity, high blood pressure, diabetes, cardiac and kidney disease that was linked to Black and Brown Americans having more severe and deadly cases of COVID-19. And unfortunately, next slide, please. And unfortunately, the percentage of Black people dying of COVID was disproportionate to the percentages of Black people and brown folks that lived in their respective states. Next slide, please. So the distrust, everyone's talking about the distrust of the vaccine, the hesitancy, but I'm just going to call it the distrust. Well, when you look at the history of medicine, lots of, well, starting in slavery, there were experimental procedures that were done on slaves, including, I'm thinking of gynecological tools like the speculum on slaves without even using anesthesia. And then when you talk about Tuskegee, which I have a feeling that a lot of us on this Zoom has heard about Tuskegee, at which they were telling these Black men that they were getting free health care, yet they were pretty much not treating their syphilis and letting the syphilis just kind of ravage their bodies, which affects their brains, their kidneys, their hearts, joints. It pretty much affects a lot of different things in the system. And this could be passed on to their partners, their sexual partners, and passed on to their newborn kids or babies. So when you think about that, the mistrust is real, and that study lasted for about 40 years. There's also what we call race-based medicine, because in medical school we're taught, well, different diseases, or if you're like Black, or if you're white, or if you're Asian, or if you're Latino, you're going to have different diseases. But then there's been some genetic studies that have come out that shows that pretty much our genetics is pretty mostly the same, that we shouldn't be using these shortcuts of race to be deciding or making diagnoses and treatments. We should be just taking the patient's history and taking their family history. And then that leads us to be able to have a better idea of what's going on with our patient. So, oh, and lastly, how patients feel when they come into our hospital and clinical setting. A lot of times I hear patients, Black and brown patients, saying that they just did not feel valued when they came to the emergency department. And that may be due to, well, the bias that we have, unfortunately, our implicit bias, our overtly explicit bias as well, where when patients don't feel valued when they come into the hospital clinical setting, how are they going to trust us when we tell them to take a vaccine that is so novel? Go ahead to the next slide. So what can we do as a healthcare system, or just as folks just trying to help our neighbor, or just help everyone get this vaccine? I mean, we're going to recognize the implicit bias, and then we're also going to recognize those racist policies that kind of kept the inequities of healthcare going. But we're going to treat everyone with respect, and we're going to recognize that, yeah, I mean, when I have patients or colleagues who say, "Yeah, I don't know about that vaccine because and then what they mean by is the history in our country with medical, yeah, with just badness. But what I do is I try to teach about how the vaccine was made. And Dr. Murray maybe is talking a little bit more about that, even though Dr. Faust did a lot of that teaching as well. But that this vaccine was like some years in the making. I mean, we had previous viruses that helped us kind of warp speed this vaccine better so that we can help nip this pandemic in the butt. But then also I have to also let the patients or my colleagues know that no safety measures were skipped over, and about 25% of participants were underrepresented minorities, Blacks, Latinos, Asians, everyone. So we should feel more comfortable about this. Next slide, please. Actually, I guess we could skip over this slide, but again, just a reminder of the different side effects. And I'm thankful for Dr. Faust really breaking that down. We'll go to the next slide. So I'm just going to end with just saying, stay positive about this vaccine. I mean, even when I got my vaccine and I signed up for it, like make a phone call at Boston Medical Center, and the coordinator on the phone was like, "Oh, congratulations!" And I was like, "Whoa!" I felt like I got the golden ticket from like the Willy Wonka chocolate factory. But just stay super positive about this, and just reminding that this vaccine will just keep you from becoming severely ill or dying from COVID. I watched I watched this documentary. I think it was with Tyler Perry actually, but Tyler Perry's mother, she had kidney disease and diabetes, and one thing that was really deep was that he said that if his mother was still alive, his biggest worry would be that his mother would end up with COVID, end up in the hospital, and dying alone. So I thought that that point was very powerful. I'm sorry, indeed. But then reminding everyone that you're protecting your family, protecting your community, and then again emphasizing the excitement of getting back to normalcy. When I go to the vaccine clinics, sorry, I got some my throat. um, I love hearing the excitement of grandparents saying that they just want to be able to hug their children, their grandchildren. They want to go to their grandkids' graduation. So I think just keep up that excitement of getting back to normalcy. And I'll end with that.